Welcome to Perioperative Chest X-ray Interpretation for Anesthesia Providers, Module 3. In this module, we will discuss evaluation of invasive line placement. The objectives and aims of this module are identifying proper position of invasive lines, including central venous catheters and pulmonary artery catheters. As a reminder, this module is not intended to direct diagnoses based on chest X-ray interpretation. A common entry point for central venous catheters is the right internal jugular vein. Optimal placement of a right side internal jugular vein central venous catheter places the tip of the catheter in the distal 1/3 of the superior vena cava, just above the superior vena cava and right atrial junction. Radiographic landmarks for central venous catheter placement include the superior vena cava, cavo-atrial junction, right atrium, and carina. The examiner notes ideal central venous catheter positioning when the tip of the catheter projects over the anatomical location of the superior vena cava and at or slightly below the carina on a chest X-ray. Is this central venous catheter correctly positioned? Yes, this central venous catheter is correctly positioned. This is a chest X-ray of a right internal jugular central venous catheter. Start by identifying the superior vena cava, the right atrium, the cavo-atrial junction, and the carina. The cavo-atrial junction is where the superior vena cava meets the right atrium. It is noted on the chest X-ray where the superior vena cava starts to flare out into the right atrium. You can follow the central venous catheter, depicted in pink, from the right internal jugular vein into the superior vena cava and note the tip resting just below the carina and just above the cavo-atrial junction. Advancing the central venous catheter into the heart chambers may lead to dysrhythmias, cardiac perforation, or cardiac tamponade. Incorrect positioning of a central venous catheter within the superior vena cava results in peripheral medication administration and inaccurate central venous pressure monitoring. This X-ray is from a case study of an 80-year-old male who received a right internal jugular central venous catheter. The tip of the catheter is almost at the level of the diaphragm and extends well beyond the distal 1/3 of the superior vena cava, presumably in the right atrium. Because the right internal jugular vein is a direct route to the right heart chambers, it is a common insertion site for pulmonary artery catheters. When placing a pulmonary artery catheter, the practitioner advances the catheter through the right internal jugular vein, through the superior vena cava, the right atrium, the right ventricle, and finally in the pulmonary arteries. Radiographic landmarks for confirming pulmonary artery catheter placement are the hyla and the cardiac silhouette. On chest imaging, the pulmonary artery catheter can be seen over the anatomical location of the superior vena cava, Then it makes a counterclockwise turn within the cardiac silhouette and ends at the level of the hyla. The tip of the pulmonary artery catheter should be within 2 centimeters of the cardiac silhouette. Is this pulmonary artery catheter correctly positioned? This pulmonary artery catheter is not correctly positioned. Begin by identifying the hyla. The hyla, also known as the lung roots, are structures containing the pulmonary vessels and major bronchi. The hyla are depicted in blue. Next, identify the cardiac silhouette, outlined in red. The pulmonary artery catheter is depicted in yellow. While the pulmonary artery catheter does rest at the level of the hyla, the tip of the catheter is obviously outside of the cardiac silhouette. The provider should withdraw the pulmonary artery catheter a few centimeters for optimal placement. This is another example of pulmonary artery catheter malposition. In this case, advancing the pulmonary artery catheter too far resulted in pulmonary artery rupture and mortality. This chest x-ray is from a case study of an 80-year-old female with a history of congestive heart failure, hypertension, and coronary artery bypass graft who presented to the emergency department with acute dyspnea. The patient required placement of a pulmonary artery catheter and was diagnosed with pulmonary hypertension. Shortly after placement of the pulmonary artery catheter, the patient began coughing up blood. The chest x-ray shows the tip of the pulmonary artery catheter in the right middle lobe. The opacities seen over the right middle lobe and the lower lobe represent alveolar hemorrhage secondary to pulmonary artery rupture.